and caregivers, sometimes leading to the oversight or misinterpretation of their issues. Initial signs of ADHD generally manifest during childhood and are frequently identified during primary school years. While the difficulties associated with ADHD might alleviate over time, they can persist into adulthood for a substantial portion of individuals. Research suggests around 50 to 70%. Essentially, many individuals with an ADHD diagnosis will experience some symptoms throughout their lives. Awareness about ADHD and other developmental conditions has increased, potentially resulting in delayed diagnoses for individuals who have struggled without receiving appropriate support. A note on diagnosis. After reading the aforementioned description, you might have silently expressed skepticism about diagnosing and medicating children based on nonconformity with adult behavioral norms. This skepticism regarding ADHD as a condition is not uncommon. The research and clinical communities have debated ADHD's existence for years. Some assert that it's merely a cultural construct, reflecting adults' challenge in tolerating and comprehending normal childhood behavior. Others advocate for recognizing ADHD as a disabling psychiatric condition. Irrespective of one's standpoint, there's substantial evidence that human beings exhibit diverse functioning patterns. Healthcare and educational professionals sometimes term this as neurodiversity. This implies that individuals vary in terms of energy levels, focus capacity, creativity, need for stimulation, social interaction preferences, and expressive modes. For those experiencing high energy levels, a proclivity for activity and novelty, and a tendency to rapidly transition between thoughts or activities, concentrating on tasks can be challenging. Whether a label is applied or not, it's well established that different modes of functioning can make it arduous for individuals to fit into structured, routine-oriented educational and occupational contexts. Accepting this, it's worth exploring adaptations, both on an individual level and within their environment, to ensure inclusivity and participation in society, regardless of their processing style. This might entail reframing diverse functioning styles, acknowledging strengths alongside challenges, and celebrating the richness of human diversity. ADHD assessment. If assessment referrals occur during a person's early years, family physicians or teachers often spot symptoms and suggest evaluation. Multiple professionals, such as GPs, child or educational psychologists, child psychiatrists, pediatricians, or other healthcare experts, might contribute to clinical evaluations. When parents or caregivers initiate an assessment, the first point of contact is typically the GP or a school psychologist. ADHD lacks a singular test. No blood test, brain scan, or physiological assessment can definitively diagnose the condition. Diagnosis typically involves a range of steps and evaluations, examining various aspects of an individual's life. These can encompass discussions with parents/caregivers to comprehend a child's development, behavior, and family dynamics. Interviews with the child/young person, or adult client if diagnosed later, to grasp their perspective on challenges. Observations of the child's conduct in diverse settings, like school and home. Questionnaires and psychological assessments addressing various functional aspects, including educational evaluations. Clinical examinations to rule out underlying medical or neurological causes for the individual's problems. This list isn't exhaustive, and assessment approaches might vary based on local services and the severity of each case. It's also crucial to recognize that certain conditions might resemble ADHD in certain aspects, example Asperger's or autism, leading to potential multiple diagnoses or initial misdiagnosis. Understanding life with ADHD. Edward M. Hallowell, an American psychiatrist diagnosed with ADHD, describes it as having a race car brain with bicycle brakes. He conveys that comprehending the experience of having ADHD can be difficult for others. To him, it's akin to a mixture of often contradictory tendencies and traits that swirl within you, influencing different aspects of your life at various times as it inconsistently navigates. 2006, p. 20. Hallowell captures the inconsistencies and contradictions in ADHD symptoms not always fully acknowledged elsewhere. He enumerates some perplexing ADHD characteristics. Other indications of ADHD encompass challenges in planning and organizing, unpredictability and impulsiveness, relatively lower inhibition, verbalizing and acting on immediate thoughts, ability to think swiftly, originally, and creatively, thinking outside the box, irritability and boredom in the absence of sufficient stimulation, a tendency to repeat mistakes multiple times. These tendencies can be daunting and impede educational and vocational attainment without appropriate support or comprehension. Moreover, consistent challenges in environments requiring organization, sedentary behavior, routine tasks, or prolonged concentration, such as school or work, can adversely affect mental and physical health, sometimes more than the initial difficulties. As previously mentioned, ADHD typically manifests in childhood and can manifest in diverse ways, including, but not limited to, the following. Psychology. Infancy/toddler years. Irritability, heightened crying compared to peers. Sleep issues. Selective eating habits. Restlessness. Preschool/nursery years. Short attention span, difficulties with sustained focus. Mood fluctuations, bursts of anger. Fine motor skill challenges. Limited interaction with peers. Primary school. Challenges in adhering to rules and sitting quietly. Reading problems, academic struggles. Difficulty collaborating with peers. Concentration and focus issues. Secondary school. Ongoing academic difficulties. Tendency to question authority. Time management problems. Forgetfulness. Tendency for boredom and distraction. Impulsivity and occasional irritability. Engagement in risky behaviors, smoking, drinking, substance use, sexual experiences, etc. It's conceivable that lacking proper understanding or support, a child or young person grappling with daily tasks and relationships might develop emotional and behavioral issues in response to their environment's reception. Children and youth might frequently face reprimands from parents and teachers, experience bullying, feel perpetually misunderstood or inadequate, and confront isolation and stigmatization. Particularly with young individuals, the impact of labeling and diagnosis communication warrants consideration. Adapted from the University of Derby online short course Understanding Autism, Asperger's and ADHD. ADHD in adults. As we transition into adulthood, our surroundings evolve, and we may pursue higher education or vocational training. Many of us will undertake numerous jobs, and some might even embark on multiple career paths. Financial independence is gained, offering new avenues for exploration and experimentation. Establishing families, caring for children and pets, managing mortgages, and more become part of the tapestry of life. While some individuals diagnosed with ADHD observe a reduction in symptoms over time or manage them effectively to near imperceptibility in adulthood, many continue to experience core ADHD symptoms throughout their adult lives. Absent the right strategies and support, this can lead to a host of challenges. Inattention and impulsivity can lead to workplace issues, unemployment, relationship difficulties, financial management struggles, and more. The sense of failure may linger, accompanied by feelings of loneliness, misunderstanding, and profound frustration with oneself and the world at large. ADHD often coexists with substance abuse, potentially driven by a proclivity for risk-taking behavior and attempts to self-medicate the emotional distress stemming from ADHD-related challenges. Additionally, the likelihood of depression and anxiety accompanies ADHD symptoms, contributing to low mood and heightened anxiety in affected individuals. The causes of ADHD. Despite extensive research and speculation, the precise causes of ADHD remain elusive. It appears that ADHD arises from a combination of contributing factors that interact in complex ways. However, it is firmly established that ADHD is not a result of poor parenting nor indicative of a bad character